Welcome to the Back Talk Podcast, where we talk about your back so it doesn't talk back to you. Hosted by Dr. Peter Peduzzi, Clinic Director at American Back Centers. Each episode explores real solutions for back pain using non-invasive, non-surgical care designed to help you avoid spinal surgery. Helping people throughout the greater Pittsburgh area feel better naturally, without the hardware or the drama.
Today, we're walking listeners through what really happens during that very first visit, from the moment they walk in to the moment that they leave. Welcome, everyone. I'm Julie Schwenzer, co-host and producer with Dr. Peter Peduzzi, the clinic director at American Back Centers. Dr. Peduzzi, it's great to be back with you. How is it going today in the office?
It's great. Wednesdays are typically my day off, so just doing paperwork, and it's going great. Thanks for having me again.
Oh, yeah, we're so happy to talk to you and learn more about your organization. So, what should patients expect during their first visit at American Back Centers?
Typically, when the patients schedule a consultation, they'll either do it either online or talk to one of our office staff and make the appointment. We'll suggest that they bring in imaging if they have it, or have it faxed over or sent over to us. We have that readily available for us when we examine them and do the consultation, and then it helps us make a better interpretation if they'd be a good candidate for our procedures here at the American Back Centers.
And then how do you go about that, getting all the medical history? Are there any expectations for the person coming in to like have their paperwork or login ready, to their portal where all their medical history is, maybe with like a hospital system or
Yeah,
something?
yeah, that's a great question, and we make it easy for patients. A lot of their paperwork they can do online and send it right to us, so they can do it at home. And once they're here, they're pretty much ready to go at that point, and they can come back and talk with me. We do a consultation right away. As far as imaging, we do X-rays in the office. We have an MRI facility right across the street from our office if we need that to be done as well. But in many cases, people come in, they've already had MRIs or X-rays, so we just encourage them to bring in the disc or the films, or at least the report from the radiologist, so we can have an idea of what's going on before they even come in.
And that disc is actually like a CD-ROM, or what is that?
Yeah, believe it or not, people
Old
still
school.
have that, and, we have one. I have one right under my computer here now. So when people bring in a disc, if they don't have the films, a lot of people don't do the films anymore. I mean, we can get the images off the hospital portals as well, but sometimes people like to get a burnt copy of the disc, and they'll bring it in, and we can take a look at it together.
And then can you please explain what happens during the initial physical evaluation?
Yeah, so when the people have, their paperwork filled out, typically at home, they can do it online. We get all that, we take a look at that, and then when we bring them back, we're gonna do a detailed history. We're gonna ask you about your problem, how you got here, what you've done prior to coming to see us, and then we'll do a very thorough examination, both neurological and physical examination. And then if need be, we can do X-rays right in the office. We can refer them out, as I mentioned, for an MRI, which is right across the street, the facility. And then we'll go over what treatment options may be best for them. And we'll describe the treatments thoroughly, and we'll make sure the patient understands thoroughly what they're getting into and any costs involved. If there's any out of pocket expense whatsoever, all that will be discussed with them before we do anything.
Yeah, I love that transparency. I'm sure a lot of people appreciate that.
They do. They do.
Yeah. And how do you determine whether a patient is a good candidate for non-surgical or non-invasive care, like off the bat, or does it take a couple visits to really diagnose that?
Yeah, I mean that's a great question. So I mean, obviously, we're going to make sure there's no reason why we would harm the patient in any way, any contraindications. We're going to rule that out first, right? For their safety as well as ours. Um, but also, we're going to see if there's any indication, say for the disc treatment, if they have a bulging disc, degenerative disc, spinal stenosis, sciatica. Those are all great indications for our treatment. Of course, we're going to make sure, again, like I said, the patient doesn't have instability of the spine, weak spine, severe osteoporosis, tumors, those type of contraindications, which they could not do the treatment. And if they don't have those things, then we look and see if they'd be a good candidate for our treatments.
And then also when you think about like the pain levels, and I know that we all answer these questions when we go into the doctor's office or nurse practitioner's office, how do you gauge the pain levels? Because sometimes it can be I was just curious about this. Sometimes it could be tough to measure when, it's not your body, but you can see that the person is maybe suffering or their idea of pain could be different from somebody else's.
Yeah, I mean, everyone's is different. I mean, obviously, we grade the pain. We ask them. We have a scale system here right on my desk of from 0 to 10, and 10 is really the worst pain they individually have had in their life. So everyone's 10 is different, like you said. So, it's based off of their individual 10. Most people's 10 will say or would be like pregnancy, kidney stones, even gunshot wounds. Heavens forbid, but those are tens. But everybody's tens is 10 is different, and on that note, a lot of people will come in with limited symptoms, and then when we do the X-ray or MRI, and we'll see truly how bad it is. So again, symptoms aren't everything, but they are very important.
And then I know that this is a broad question, doctor, but what can patients expect after they walk away from that first appointment? What's like the plan usually for them?
Patients are going to know one way or another if they potentially are a good candidate for the procedures we do here. And if we need further imaging, like I said, we can do x-rays in the office. We'll have them come back and go over those x-rays as soon as possible. If we need to write them a prescription for an MRI, we can do that. We typically schedule the appointment. We get them on the phone right in the office with the MRI facility and get them scheduled right away. We don't mess around. And then they get that MRI ASAP. And then we have them come back and go over the findings as soon as possible as well.
And I know that, obviously your American Back Centers. Does that cover like the entire back? What if somebody has shoulder pain and it's like radiating down the back? How do you assess that?
Yeah, I mean, we are the American Back Centers. We do specialize in that type of body area, but of course, we treat any musculoskeletal issue. The VAXD addresses the neck, disc problems in the neck, of course, shoulder, any musculoskeletal issue, knee, hip, any of those issues can be addressed with the therapy and rehab we do here, chiropractic, as well as the specialized procedures we do here.
And I guess I just have a last question for you because I was thinking about this. How does somebody come to American Back Centers? Do they have to have a referral? Can they just come in because they're just unsure of the source of their pain in their back?
Yeah, I mean, you don't need a referral to come see us. We are a port of entry doctor facility, so we don't need that. There may be a random insurance company that does require that, but that's few and far between. In majority of the cases, 99.9% of the time, you do not need a referral to come see us.
Okay, well, Dr. Patuzzi, that was very helpful. And thank you so much for helping people feel better because it's so important.
Well, thank you so much for having me.
Thanks for listening to the Back Talk Podcast. If back pain is slowing you down or bossing you around, it may be time for a natural approach that works. Call 724-935-3300 to schedule a consultation with one of the doctors at American Back Centers or visit AmericanBackCenters.com.
At American Back Centers, you've got nothing to lose but the pain.